Thank you very much. I'm really pleased to be here and to have an opportunity to present this new study of our project. This is a kind of important aspect of health inequality, yet it hasn't been really researched as much as it should be, maybe, and especially for the First Nations population. So my topic today is avoidable mortality among First Nations adults in Canada by using the cohort analysis. Even if the topic and the focus is the First Nations population, throughout the analysis we have provided the comparisons between the First Nations population and non-Aboriginal Canadian population. Simple outline for this presentation is I'm going to talk about brief context and then methods and data, and of course I present the major findings of this project, and we're going to share the conclusions of this study. The background about research of avoidable mortality. So avoidable mortality means the deaths that could have been potentially avoided throughout prevention practices or public health policies and better treatment and provision of timely and effective health care. So how many people and to what extent the avoidable mortality is an important issue in health area that can kind of give us a good indicator about the nations, probably societies, healthcare systems function. And in factuality, about 70% of all deaths, not the all deaths entirely, but all deaths under the age of 75 actually is avoidable death. And also, we expect that the distribution of these avoidable deaths is not really equal. So specific population may have and specific causes of death may be more prevalent in terms of this avoidable mortality. So that is that has been pointed out in the previous literature on avoidable mortality research. But unfortunate thing is we have very limited information and data about the avoidable mortality among specific subpopulation. And especially First Nations people, we don't, for the First Nations people, we do not have a sufficient information about avoidable mortality, even though we have a general information about life expectancy or cause of death, things like that. Those general health information is available, but avoidable mortality among First Nation population, maybe this study is one of the first type of such studies. And research objective is very straightforward. We'd like to investigate whether First Nations adults have a higher than expected rate of avoidable mortality when compared with a non-Aboriginal population. And second object is we'd like to investigate where such health inequalities are more prevalent in terms of a specific cause of death. And the last objective of the study is how socio-demographic factors like income and education are related to the prevalence of avoidable death. So this study about avoidable mortality is possible because of this data set. So we are using a 1991 Canadian Census Cohort. So Canadian Census Cohort database is based upon 1991 Census long form information. And we selected the respondents aged 25 or older. So we have a database about Canadian adult population. So we have a 25 and older at the baseline time of June 4th, 1991. And this database does not include the institutional population. So the total, the sample size, total N is 3.5 million. And for this analysis, our sample size, because we are dealing with, I'm going to talk about definition of avoidable mortality in more detail shortly after, but we are talking about death before the age 75, so our sample is including only the individuals aged 25 to 74 at the baseline. And so that total is 2.5 million, and First Nations population is about 61,000. And Canadian Census Cohort, it has a contents of course, the census information, census long-form information. So it has many advantage because we have a demographic information, labor market information, income, education, language, disabilities, housing, immigration. So all those information is available through the 1991 census long-form information. But unique thing about this 1991 Canadian Census Cohort is that long-form information of 1991 census is linked to other important data sets. So census cohort is linked to the, for example, vital statistics, mortality information, and cancer registry. So the cancer information is linked to the census information, and also labor force information and tax information. So all those different important socio-demographic databases are connected under the big project of 1991 Canadian Census Cohort study. But for my study, for our study, we're going to construct a data set based upon census information and mortality information. So let me explain a little bit about the basic output variable in this study. We have a premature death, avoidable death, preventable death, and treatable death. So if I use this one, so first thing is mortality. So sooner or later, everyone dies. So this is a mortality, including any kind of mortality, suicide, homicide, or cancer and everything. So we have mortality here. And under the mortality, we have premature death and death after age 75. So in the Canadian society, basically we are expected, everyone is expected to live more than 75 years of lifetime. So some people, some individuals die before age 75, that is premature death. Okay? And if people die after age 75, that's not the premature death, and that's a death after age 75. But under the premature death, we have avoidable causes and unavoidable causes. So we are interested in these avoidable causes because that's the death that should not happen. And under the avoidable death, we have two different groups of causes. Some deaths are avoidable because we can do something about with a good measurement, a good measure of prevention. And the other part of the avoidable death is treatable death. So even if some diseases or some incidents or some factor, some almost a lethal factor happens to the individuals, we can treat them with an effective healthcare system or with effective medical care, advanced ones, things like that, operation. So under the avoidable death, we can have preventable causes and treatable causes. Let me give you just an example before leaving this slide. So premature death, any death before age 75. But how about what is the unavoidable death? Oh, I would say pancreatic cancer. So Steve Jobs died of that. So pancreatic cancer is an unavoidable death, unavoidable cause of death. And avoidable one, we have many things, but preventable, if we use a cancer case, lung cancer. Lung cancer is now classified as a preventable cause of death. And treatable, colorectal cancer. So we have a series of the ICD, the codes list, which are preventable and which are treatable, which are unavoidable. So based upon that classification, we have this line of concepts, and that's the basis of our analysis. For the statistical analysis, because we are using the cohort analysis data, so we calculate percentage of risk for each individual, and the sum of that will work as a denominator of any rates. And of course, the numerator is the event, so like avoidable deaths and treatable deaths and preventable deaths will be the numerator. So based upon those information, we calculate the crude rates, and then based upon five class crude rates, we calculate age-adjusted mortality rate. And for that, we did use a standard Aboriginal population. Okay, and based upon ASMR, age-standardized mortality rates, we calculated rate ratios and rate differences, and also we did conduct a multivariate analysis, and we calculated the Cox proportional hazard ratios. Okay, as a kind of first finding, it's not exactly finding, but it's a sample characteristics. It's not really surprising, but if we compare First Nations population and non-Aboriginal Canadian population, First Nation population is, of course, much younger. So we see a high proportion of 25 to 34. And as opposed to 55 and over is big difference between the two population groups. And educational attainment and income adequacy quintile information also shows a kind of clear differences. We have a higher proportions of less than high school graduation among First Nations population, and income adequacy is quite related to that one. We see high percentages over here. Male and female quite similarly. So that's a sample characteristics, and this is the graph of the age-specific mortality rate per 100,000 person years at risk. As you can see, premature deaths, avoidable deaths, preventable deaths, treatable deaths. Throughout all the categories of premature mortality, we have a clear differences. So it's like this is the graph of the age standardized mortality rate, but if we convert that to rate ratios is about 2. So the mortality rate per First Nations in this graph is for man. It's twice as high compared to non-Aboriginal population. Same trend has observed. Actually, it's a little bit more differences were found among female population between First Nations and non-Aboriginals. So this is a mortality rate for premature, avoidable, preventable, and treatable death. And we'd like to know more about it. So previous slides show the general kind of trend of the level of mortality. But what kind of specific causes really really drives the difference between the two population groups in terms of health inequality, mortality inequality. So this graph shows RR, that's rate ratios, so it's based upon the age standardized ASMR and mortality rate, and we provide the confidence interval at 95%. And I added a First Nations number of deaths because for certain cases the rate ratio is high, so disparity looks big, but maybe the number of deaths is really small. So we have added the First Nations number of deaths as well, but the number is not, we don't have a really small kind of problematically small number of deaths not there. But as you can see, alcohol and drug use disorders as a underlying cause of death, that is the place. That is the specific cause of death. We find a huge difference in terms of avoidable death. And next one, by the way, this is for men again. And the second important cause is unintentional injuries and diabetes mellitus and infections and a disease of the circulatory system and suicide and self-inflicted injuries. And the Health Canada colleagues mentioned about this table. And we have the suicide and self-inflicted injuries is one of the important the causes in avoidable deaths differences. But remember, our study, because of our data set, only included adult population, 25 to 75. So if we have maybe 15 to 24, then we may have more differences in suicide and self-inflicted injuries. So, but anyway, even with the adult population, we still have those cases as especially important. And quite similar, slightly different, the case for women. Alcohol and drug use disorders are still big there, and diabetes, infections, and unintentional injuries, and disease of respiratory system and disease of circulatory system. So that's the causes of death. We found huge differences in avoidable deaths between the two population groups. And next one is hazard ratio of dying from avoidable causes for First Nations. So the red line, the cross, that's the line indicates if we have no difference, no inequality, then a graph should be end there, 1. But we have the hazard ratio of 2 or 2.5, things like that. So that means existence of inequality in terms of avoidable death in here. But in this table actually shows us the two things, maybe 3 things. So existence of significant difference, that's one thing. And the second thing is the different bars showing the trend of going down. And the first bar is we control just age. Second, we control age and education. Third, age and income. And fourth, age, education, and income, so everything. So if you see that, if we control more socio-demographic factors, then the level of inequality reduces. But at the same time, even after controlling income and education, still there exist differences and inequality. And another thing we can learn from this chart is difference between men and women. So for women, we found bigger differences between the two populations, First Nations and non-Aboriginals. And age-wise, throughout age-wise, maybe with an except of 65 to 74, we have the significant difference between the two populations, and especially younger age group, 22 to 34, we have the bigger difference level. And quickly, the limitation, using the census is great, lots of information, but if we don't catch information by that census, we don't have the information for this study. And First Nations definition is strictly based upon ancestry and not the identity in 1991. So that may cause a problem. And level of education, income adequacy, we control that, but we have only information at the baseline, which is 1991. So that can cause follow-up years, like 20 years later, maybe situation is different. And sample size, First Nations cohort is big enough, but for the kind of detailed analysis, it still has some problems. So I could not go in more detail cause of death. So I used the kind of general categories of death, but we did quite specific causes of death anyway. And there is no internationally agreed upon definition of avoidable death, so this is a good thing, but if you want to compare avoidable death levels internationally, you have to be cautious somewhat. So, conclusion, compare with non-Aboriginal cohort members, a higher proportion of premature deaths among First Nations cohort members occurred due to avoidable causes, significantly higher avoidable deaths. Second, the disparity in mortality is more pronounced among women than men, and among younger age groups, and for specific causes like unintentional injuries, alcohol and drug use disorders, and diabetes mellitus. Those are the big ones. And income and education can explain an important portion of differences in avoidable mortality prevalence between First Nations and non-Aboriginal population in the study. And these findings makes possible our study, and if you have further questions, this is the contact information. Thank you very much.